After studying this module, you will be able to know about benzodiazepines and their types, mode of action and pharmacokinetics of benzodiazepines, forensic examination of benzodiazepines. Benzodiazepines are one of the most extensively prescribed groups of drugs and are recurrently found in toxicological cases. Benzodiazepines are one of the most significant groups of psychotropic drugs. They are extensively used as tranquilizers, sedatives, and hypnotics. Ever since the introduction of benzodiazepines in the 1960s by Leo Sternbach, they have developed progressively, more popular as anxiolytic agents and sedatives, displacing the barbiturates from their held top spot hitherto. In spite of widespread use worldwide, there have been only a few cases reported involving fatalities, demonstrating the wide margin of safety of benzodiazepines. But self-satisfaction must be avoided, and the safety profile of these drugs should not be taken for granted, as deaths have been reported in some recent cases even from unexpectedly low doses of certain benzodiazepines. There are also indications that some of the newer benzodiazepines have a slightly smaller threshold of safety. Another important issue is with reference to the use of benzodiazepines to deliberately induce amnesia in certain individuals in order to accomplish an immoral act, example, date rape. Many of these drugs, mainly flunitrazepam, are capable of causing retrograde amnesia. Flunitrazepam, Rofinol or Rufies has become popular as a drug of abuse, often combined with alcohol, marijuana or cocaine to produce an intense high. It has been used as a date rape drug, both for its properties of lowering inhibitions and because it can cause retrograde amnesia. While addiction to benzodiazepines is an undeniable possibility among patients on long-term therapy, the abuse potential is much less when compared to most other sedative hypnotics, such as the barbiturates. Withdrawal reactions are also generally less severe and more easily managed. Appearance of forensic exhibits. Confiscation of benzodiazepines may involve mainly of pharmaceutical substances formulated as tablets, capsules, oral liquids or injectable, and should be sampled depending on the number and type of dosage units seized. Next is chemistry of benzodiazepines. The configuration of benzodiazepines are based on a 5-aryl 1,4-benzodiazepine structure. This is the generalized structure of benzodiazepine. Molecular structure of some common benzodiazepines: diazepam, flunitrazepam, nitrazepam, flurazepam, temazepam, clonazepam, alprazolam, and bromazepam. Important benzodiazepines generally encountered in forensic arena: alprazolam, bortezolam, chlordiazepoxide, clorazepate, clobazam, clonazepam, diazepam, estazolam, flunitrazepam, flurazepam, halazepam, lorazepam, lormetazepam, medazepam, midazolam, nitrazepam, oxazepam, pinazepam, prazepam, quazepam, temazepam, triazolam, and zolazepam, etc. Benzodiazepines are formulated largely as capsules and tablets. However, some are available in other pharmaceutical forms, such as injectable solutions. Diazepam, the most traded and widely available benzodiazepine, can be found as capsules, tablets, aqueous or polyethylene glycol solutions for injection, syrups and suppositories. They are commonly present as the free base or as the hydrochloride mesylate or other salt. However, some also have carboxylic acid functionalities and may be presented as potassium salts. Example, chlorazepate. All the benzodiazepines are generally soluble in methanol. Classification of benzodiazepines. Benzodiazepines are characterized on the basis of their action, short-acting benzodiazepines. Short-acting compounds have an average half-life of 1 to 12 hours. They have few residual effects if taken before sleep time. Rebound insomnia may occur upon discontinuation, and they might cause daytime withdrawal symptoms such as next day rebound anxiety with prolonged usage. Examples are bortezolum, midazolam and triazolam. Intermediate acting benzodiazepines. Intermediate acting compounds have an average half-life of 12 to 40 hours. They may have some residual effects in the first half of the day if used as a hypnotic. Rebound insomnia, however, is more common upon withdrawal of intermediate acting benzodiazepines than longer acting benzodiazepines. Examples are alprazolam, estazolam, flunitrazepam, clonazepam, lormetazepam, lorazepam, nitrazepam and temazepam. Long-acting benzodiazepines. Long-acting compounds have a half-life of 40 to 250 hours. They have a risk of accumulation in the elderly and individuals with severely impaired liver function, but they have a reduced severity of rebound effects and withdrawal. Examples are diazepam, chlorazepate, chlordiazepoxide and flurazepam. List of some benzodiazepines and their action duration. Lorazepam, intermediate, flurazepam, long-acting, quazepam, long-acting, triazolam, short-acting, clonazepam, long-acting, chlordiazepoxide, long-acting, clobazam, long-acting, estazolam, intermediate, temazepam, intermediate, oxazepam, intermediate, chlorazepate, long-acting, diazepam, long-acting, midazolam, short-acting, alprazolam, intermediate. Fatal dose. It is ambiguous for most benzodiazepines. Even consumption of up to 2000 mg diazepam has not resulted in death, or for that matter, even serious morbidity. However, several cases of fatality due to triazolam and flunitrazepam overdose have been stated. In general, benzodiazepine metabolism appears to be inhibited by ethanol when given concurrently. Clinically associated administration of high doses of ethanol and benzodiazepines act to synergistically reduce respiration. Next is mechanism of action of benzodiazepines. Benzodiazepines express their pharmacological activity by binding to the so-called GABA A receptor, which mediates the effect of gamma aminobutyric acid, that is GABA, the inhibitory neurotransmitter in the brain. After binding to the receptor, the benzodiazepine locks the GABA A receptor into a conformation in which the neurotransmitter GABA has higher affinity for the receptor. This increases the frequency of opening of the associated chloride ion channel and causes hyperpolarization of the membrane. As a result, the inhibitory effect of the available GABA is increased, leading to sedation and other symptoms. In addition, benzodiazepines cause hypnotic, anticonvulsant, muscle relaxant and amnesic effects. As a result, the inhibitory effect of the available GABA is increased, leading to sedation and other symptoms. In addition, benzodiazepines cause hypnotic, anticonvulsant, muscle relaxant, and amnestic effects. Although most benzodiazepines trigger the same physical effects, their dosage and absorption time into the bloodstream can vary extensively. Pharmacokinetics of benzodiazepines. Most benzodiazepines are administered orally or by intravenous injection. Intramuscular injection may lead to irregular absorption. However, lorazepam and midazolam are exception to this and can be given intramuscular. Following absorption, all benzodiazepines are bound to plasma proteins to the extent of 70 to 99% and are metabolized broadly by different microsomal enzyme systems in the liver. Metabolites are invariably as active as the parent compound. Some benzodiazepines are eliminated from the body gradually. Thus, ingesting multiple doses over long periods of time can lead to substantial accumulation in fatty tissues. Hydroxylation and demethylation of the benzodiazepine diazepam gives the metabolites temazepam and oxazepam, both of which are also available as drugs. Next is effects of benzodiazepines. Weakness, headache, amnesia, vertigo, diplopia, nausea, diarrhea, and rarely chest pain are the effects of benzodiazepine consumption. Besides, paradoxical effects, disinhibition or discontrol reaction may sometimes occur, characterized by restlessness, agitation, and hallucinations. Flurazepam has been associated with nightmares and hallucinations. Allergic, hepatotoxic, and hematological reactions are nearly rare. Drug interactions of benzodiazepine. Ethanol has a synergistic effect with benzodiazepines and increases both the rate of absorption as well as association with CNS depression. Similar effect is also seen with associated administration of phenothiazines and barbiturates. Sodium valproate may cause psychotic reactions when given along with benzodiazepines. Uses of benzodiazepines. Benzodiazepines are suggested for relaxation, calmness, and relief from anxiety and tension. Medically, benzodiazepines are used to treat ailments, seizure disorders, anxiety disorders, movement disorders, insomnia, mania, for inducing skeletal muscle relaxation, pre-anesthetic medication, treatment of alcohol withdrawal. Signs and symptoms. Benzodiazepines are one of the harmless drugs when their overdosage occurs alone. Cases have been reported when as many as 70 tablets of any of them are unlikely to produce anything more than mild effect in most adults. Various benzodiazepines have active metabolites that justifies for their prolonged sedative effects. Benzodiazepines potentiate the effect of other CNS depressants, particularly alcohol, tricyclic antidepressants, and barbiturates. Flurazepam is most likely to produce significant CNS depression. The signs and symptoms that are produced are drowsiness, dizziness, ataxia and slurred speech, respiratory depression, hypotension and coma. Long-term use of benzodiazepines is associated with the development of tolerance. Tolerance to certain benzodiazepines occurs most often in those who have used for 6 months or more. Next is withdrawal symptoms of benzodiazepines. Symptoms of withdrawal from benzodiazepines are mainly insomnia, gastric problems, tremors, agitation, fearfulness, muscle spasm. However, few recurrent effects comprises of irritability, excessive perspiration, depersonalization, derealization, allergic reaction to stimuli, depression, suicidal behavior, psychosis, seizures, and delirium tremens. Severe symptoms typically occur as a result of abrupt or over-rapid withdrawal. Abrupt withdrawal can be dangerous. Therefore, a gradual reduction procedure is suggested. Next is extraction of benzodiazepines for forensic analysis. Benzodiazepines may conveniently be extracted into methanol for both qualitative and quantitative analysis. The dose form should be triturated in methanol, and any solid material may be removed by centrifugation or filtration prior to analysis of the drug in the solution. Subsequently, presumptive tests, TLC, and confirmatory analysis are then carried out on the prepared extract. Presumptive analysis for benzodiazepines, Zimmermann test, preparation of reagent, solution 1, 2,4-dinitrobenzene, 1% weight by volume in methanol. Solution 2 is 15% potassium hydroxide aqueous solution. Procedure: on a micro test plate, place appropriate quantity of the sample to be tested. Add 1 drop of solution 1 followed by 1 drop of solution 2 and mix. Result: red purple to pink color indicates the probable presence of a benzodiazepine. Next is Vitali-Morin's test, preparation of reagent, solution 1, concentrated nitric acid, solution 2, acetone, solution 3, 0.1 normal ethanolic potassium hydroxide. Procedure: on a micro test plate, place adequate quantity of the sample to be tested. Add solution 1 followed by solution 2 and further followed by solution 3 and mix. Result: yellow-orange indicates the possible presence of benzodiazepines. Next test is Marquis test, preparation of reagent. 1 volume of formalin is added to 9 volume of concentrated sulfuric acid. Procedure: on a micro test plate, place adequate quantity of the sample to be tested. Add the reagent and agitate. Result: yellow-orange indicates the possible presence of benzodiazepines. Next is formaldehyde sulfuric acid test, preparation of reagent. 4 parts of sulfuric acid is added with 6 parts of formalin. Procedure: as mentioned in the above tests. Result: red, pink, blue, violet. Red violet, blue violet indicates the possible presence of benzodiazepines. Hydrochloric acid test, preparation of reagent, 0.2 normal hydrochloric acid. Procedure: as mentioned earlier. Result: presence of yellow color points towards the possible existence of benzodiazepines. Instrumental analysis for benzodiazepines, thin layer chromatography. Stationary phase, activated silica gel with or without fluorescing substance, TLC plates of 0.25 or 0.20 mm thickness. Mobile phase, solvent system A, chloroform and acetone in the ratio of 80:20. Solvent system B, chloroform is to methanol in the ratio of 90:10. Solvent system C, cyclohexane, toluene and diethylamine in the ratio of 75:15:10. Sample preparation. The solutions of exhibit powder, tablet or capsules and standard may be prepared in methanol. Spraying reagents. Dagendorf reagent. The color of spots would be orange. Acidified iodoplatinate reagent, the color of the spots would be purple. Visualization. The plates must be dried prior to visualization at 120 degrees Celsius for 5 minutes in an oven or by using a hot air blower to remove all traces of diethylamine from the plate. Benzodiazepines form a mixed group of chemicals. However, the above mentioned 3 thin layer chromatographic systems, when used in combination, give good separations for a number of benzodiazepines. Solvent system C is a general system suggested also for the identification and analysis of cocaine, opium and amphetamine or methamphetamine. Preparation of spraying reagents. Regenroth's reagent. 1 gram of bismuth subnitrate is dissolved in 3 ml of 10 molar of hydrochloric acid. It is diluted to 20 ml. 1 gram of potassium iodide is dissolved in it. If black precipitate of bismuth triiodide separates, it is dissolved in 2 molar hydrochloric acid. Acidified iodoplatinate reagent. 0.25 gram of platinic chloride and 5 gram of potassium iodide is dissolved in sufficient water to produce 100 ml solution. This is potassium iodoplatinate reagent. For the acidified version, 5 ml of concentrated hydrochloric acid is added to 100 ml of iodoplatinate solution. Next is gas chromatography. It is a procedure whereby volatile components of a mixture may be separated by partition between a solid or liquid stationary phase and a gaseous mobile phase. The efficiency in the separation is attained by controlling several factors, viz. Column type, capillary or wide bore, column length, column diameter, nature of liquid phase, carrier gas, flow rate and temperature. This technique has now been hyphenated with other techniques, viz. SFC-GC and GC-MS. Although gas chromatography can be recommended as a suitable method for the analysis of most benzodiazepines, several of them, particularly the 3-hydroxyl derivatives, undergo thermal degradation and rearrangements. Chlordiazepoxide, cloxazolum, lormetazepam, haloxazolum, oxazolum, ethyl loftazepate and temazepam yield multiple peaks. Next is UV visible spectroscopy. Benzodiazepine derivatives may be studied by scanning the samples in appropriate organic solvents with the help of UV visible spectrophotometry. The value of Imax of the spectrum can be compared with the standard value given in the literatures or with using the standard sample of benzodiazepine derivatives. Compound and their absorption maxima in nanometers in different types of solutions: 0.5 normal sulfuric acid, 0.5 normal sodium hydroxide and ethanol. Compound is alprazolam. Absorption maxima is 260 nanometers in 0.5 normal H2SO4. Similarly, it has been given for the various compounds like clonazepam, diazepam, flunitrazepam, flurazepam, ketazolam, lorazepam, nitrazepam and temazepam. Next is gas chromatography, mass spectroscopy, that is GC-MS. GC-MS is one of the mostly commonly used techniques for the identification and quantification of forensic drug samples. As a hyphenated technique, it combines the separation of a GC with the analyte specificity of a spectroscopic technique, providing highly specific spectral data on individual compounds in a complex mixture of compounds, often without prior separation. Benzodiazepine derivatives may be studied by analyzing the samples with the help of mass spectrometry, that is GC-MS. The value of principal peaks at M/Z can be compared either with the standard value given in the literatures or with using the standard sample of benzodiazepine derivatives. Identification is accomplished by comparing the retention time and mass spectrum of the analyte with that of the reference standard. GC operating conditions and parameters used for the GC-MS analysis of benzodiazepine derivatives. System and conditions. Column BP that is 1:25 m into 0.22 mm IDDF 0.25 micrometer. Injection temperature 275 degrees Celsius. Column oven temperature 250 degrees Celsius. Carrier gas is helium at a flow rate of 1 milliliter per minute. Split ratio is 20:1. Detector used is mass spectrometric detector. Temperature and settings are required. Next is HPLC, high performance liquid chromatography. The analysis of forensic samples by HPLC has become popular due to development of HPLC in attaining performance by using high performance column, new detector, optimum methods, etc. The HPLC method allows quantitative determination of non-volatile and thermally labile compounds without derivatization and much cleanup of samples. HPLC operating conditions and parameters used for the analysis of benzodiazepines. System and conditions. Column Spherisov ODS 2:25 cm into 4.6 mm ID 5 micrometer particle size. Mobile phase methyl hydroxide, water and 0.1 molar phosphate buffer at pH 7.25 in the ratio of 55:25:20 or 70:10:20. Flow rate 1.5 ml per minute. Injection volume is 5 to 10 microliter and detection is UV at 240 nanometers. Next is medico-legal aspect of benzodiazepines. Benzodiazepines are remarkably safe drugs and rarely produce serious toxic effects even with substantial ingestion. Death is exceptional unless other synergistic drugs have also been ingested. However, new benzodiazepines such as alprazolam, triazolam and temazepam are associated with fatalities. Benzodiazepine tranquilizers are prescribed widely and therefore occur more frequently than any other type of drug in overdose cases. The effects of these drugs in overdose are usually mild, although they may have a synergistic effect when taken with alcohol or other drugs. The anti-convulsive benzodiazepine clonazepam, Rivotril, is also used to detoxify patients with very severe benzodiazepine dependence. Although these drugs do not seem to cause lethal intoxications, reports of deaths from benzodiazepines have been published, most of which refer to elderly people or cases of combined overdose of flunitrazepam and opiates. We'll end this module with summary. The abuse or misuse of benzodiazepine is internationally widespread, which means that any forensic laboratory may encounter a range of these compounds. In general, benzodiazepines encountered in the illicit market are diverted from legitimated sources. Benzodiazepines enhance the effect of the neurotransmitter gamma-aminobutyric acid and are subsequently used therapeutically as tranquilizers, hypnotics, anticonvulsants and centrally acting muscle relaxants. Over 30 benzodiazepines are available. Some of these are both the parent compound and a metabolite of other benzodiazepines. All benzodiazepines and their unconjugated metabolites except the parent drug potassium chlorazepate are extractable from body fluids into an organic solvent and can be quantified in serum or plasma by normal phase HPLC with UV detection. GC and ECD can also be used. Long-term use of benzodiazepines is associated with the development of tolerance. Abrupt cessation provokes a mild withdrawal reaction characterized by anxiety, insomnia, headache, tremor and paresthesia, restlessness, encephalopathy, and hallucinations may occur after abrupt withdrawal from high daily doses. Convulsions may occur after a lapse of 3 to 10 days. Withdrawal reactions of benzodiazepines are also generally less severe and more easily managed. However, abrupt cessation after prolonged use. Benzodiazepines, specifically alprazolam and diazepam, are among the most often diverted and abused psychotropic substances.